Let's talk about therapy speak. Have you ever been in a fight and someone says you're gaslighting them? Or maybe you've casually called a friend a narcissist? These clinical terms have totally jumped out of the therapist's office and into our everyday chats. But here's the thing. There's a huge gap between how we're using these words and what they actually mean.
I mean, let's be real for a second. That term gaslighting is literally everywhere now. But is a simple disagreement where two people just remember things differently really gaslighting? This confusion is exactly what we're going to unpack today. That blurry line between just, regular human conflict and actual clinical terms.
And this really gets to the heart of the problem, doesn't it? These powerful, important terms are getting so watered down. Their trip from a clinical setting to our text messages has kind of stripped them of their real meaning. So let's break down how this even happened, and more importantly, why it actually matters.
Now, look, this whole trend isn't all bad. Not at all. In fact, it shows a really positive thing. People are getting more and more interested in mental health. But as psychologists like Dr. Susan Albers-Bowling point out, there's a pretty big downside when these really complex ideas get oversimplified.
So on one hand, it's awesome that people are curious about psychology. That's the upside, for sure. But the downside? It's a big one. When we start throwing these terms around without really getting what they mean, we can end up sounding manipulative or just, pushing people away instead of connecting with them.
All right, so let's get into the nitty-gritty. We're going to take a look at some of the most misused terms out there. We'll put them side by side, how we use them on social media versus what they actually mean in a real clinical setting.
Let's start with the big one, gaslighting. Casually, it's become this shield to shut down an argument and kind of dodge responsibility. But clinically, whoa, it's a severe form of psychological abuse designed to make someone literally question their own sanity. The difference isn't just small, it's massive.
And what about narcissist? We toss that word around for anyone who's being a little selfish or rude. But narcissistic personality disorder, or NPD, is a serious, legitimate clinical diagnosis. It's not about one selfish act. It's a deep-seated, long-term pattern of behavior.
And Dr. Justin Puter really nails it with this quote. This isn't just about someone having a bad day or being inconsiderate. He's highlighting that clinical narcissism is this ingrained, pervasive pattern, something you absolutely cannot diagnose from one viral TikTok video.
Okay, next up, boundaries. Now, setting boundaries is super healthy, but the term often gets hijacked to just be selfish. A real healthy boundary isn't a wall you put up. It's more like a bridge. It's a conversation about your needs that also respects the other person. It has to be a two-way street.
The word trauma is another huge one. It's become so common to label any bad experience as traumatic. But psychologists actually warn that doing this can make normal, everyday challenges feel way harder to handle. Clinical trauma is about deeply distressing events that often need professional support to work through.
And attachment styles, they can be such a great tool for understanding yourself, but they're not a get-out-of-jail-free card for bad behavior. Blaming ghosting on your anxious attachment style basically turns a tool for personal growth into a convenient excuse.
Oh, I'm so OCD because I like my desk to be clean. Come on, we've all heard that, right? But obsessive-compulsive disorder is a truly debilitating condition. We're talking uncontrollable thoughts and behaviors. Using it so casually doesn't just get the meaning wrong, it really trivializes the intense struggle of people who actually have the diagnosis.
And finally, self-care. On social media, it looks like $1,000 spa days and fancy skincare. But clinically, it's way simpler. Self-care is just about the basics. Are you getting enough sleep? Are you drinking water? Are you paying attention to what your body and mind actually need? That's it.
So we've seen how all these terms get twisted, but you might be thinking, okay, so what? What's the big deal? They're just words. Well, the harm is actually real, and it goes a lot deeper than you might think.
The way we use this language, it has this hidden but really powerful impact on our relationships and even on our own self-awareness. Let's break down what those real-world consequences actually look like. So when we misuse therapy speak, it can feel really manipulative, right? Like you're using a clinical term to win an argument instead of actually solving a problem. It creates distance because you're turning a simple disagreement into a diagnosis. It also stops us from looking at our own behavior. It's way easier to label someone else than to do some self-reflection. And maybe worst of all, we water down the meaning of very serious conditions, and that hurts the people who are really truly struggling with them.
Okay, so we know the problem, and we know why it matters.
But the good news is we can totally do better. So let's shift gears and talk about a simple toolkit we can all use to navigate these conversations with a lot more clarity and, frankly, a lot more kindness.
Here's a super simple but really effective approach. First, just pause. Take a beat. The person you're talking to might actually be in therapy, and they're just trying to use the new language they're learning. And second, instead of jumping to conclusions, just ask. Ask them to clarify what they mean when they use that word. And this quote from Dr. Albers Bowling gives us the perfect script, simply asking, could you define what that means to you? It's non-confrontational at all. It just opens the door to real understanding. Because as she points out, our personal definitions for these terms can be all over the place.
So I want to leave you with this final thought. We tend to think of self-care as, bubble baths and face masks. But what if the best form of self-care is actually just learning to communicate better, with more clarity, more precision, and more empathy? Now that's something worth thinking about. Thanks for digging into this with me.